Welcome back to Managing the Academic Enterprise. This is Launchpad Learning's Week 3, covering the lesson of enrollment health. My name is Tom Shaver. I'm the founder and CEO here at Ad Astra, and we're excited to walk you through enrollment health. So why do we want to talk about enrollment health? Well, first and foremost is, as all of us know, the academic enterprise is very complex. It's a very challenging, multifaceted area to manage all of the things going on in the academic enterprise. We're allocating faculty, we're allocating space, we're managing time and schedules, and we're trying to do all of this in service of meeting students' needs while remaining financially sustainable. The challenge, though, is that the choices we offer to students can sometimes conflict with our objective or need as an institution to be financially sustainable. And we want to make sure that we're using data in a way where we can inform the trade-off between choice and sustainability to maximize student outcomes and financial health. But to do that, obviously, because of the complexity of the problem, we need to be very intentional. We found from our 25 years of working with the industry on these problems that it really requires intentional analysis and even design of how we're going to approach these topics so that when we turn around and execute through the academic schedule, that we can have better outcomes. So what are the elements of enrollment health? Well, we start with students, but unlike the relatively narrow conversation that sometimes occurs in our industry about strategic enrollment management, we want to expand it beyond just admitting more and more students in the upcoming class. We want to track also how those students actually get integrated into the application, the institution, and how they're pursuing various different programs of study. So we start out by looking at student populations. We then look at the cohorts of those students within programs and completion tracks within programs. So a completion track is something that we basically define as the way they're taking courses within that program. And then finally, we want to look at their course selections, the kinds of courses they're taking, and how they're succeeding, hopefully, in passing those courses with their progress along the line toward degree completion. So what is enrollment health? Well, enrollment health is not just an area that we look at in strategic enrollment management, but it's also a benchmark metric. It's a metric we can use to measure every cohort within every program of study and flag the cohorts that have unsustainably small or at least borderline cohort sizes so that we can try to manage those cohorts appropriately. Simply put, it's impossible to be all things to all people in higher ed these days when we talk about the myriad of programs we offer, the myriad of courses we offer within those programs, and now increasingly the myriad of ways with which we offer or through which we offer those programs or those courses. So if they're taking courses in various ways and they're taking different courses, these cohort sizes get smaller and smaller, and we need to be very careful about the smaller cohort sizes to make sure that we're meeting those needs in a sustainable way. So this can become very difficult at most institutions because most of the enrollments tend to be concentrated in a very small number of programs of study. This is a graph of an actual two-year public institution which illustrates this problem, where even looking at the 40% of their most popular programs, you can see really only the 4 or 5 most popular programs have robust total headcounts, and the remaining programs have 100, 120 and fewer students. Now that 120 in that level doesn't seem maybe too alarming, but we'll show you here in subsequent slides how those populations can become very fragmented. So when we talk about that fragmentation, it usually happens in this way, that students now have a lot of different choices, not just, again, the courses they're taking, but how they're able to take those courses. There's modality, there's part of term, there's time of day. And the way they're taking those courses is really what we define as a completion track. So we would like to see a cohesive track from start to finish where students can show up, for example, take classes on Campus One in the morning, and start to finish they can complete that program of study. Maybe they flex to other formats, but that's not ideal. But then we need to ask the question, well, when they have to flex to other formats, which formats are interchangeable? it's not realistic to expect a student to show up in the morning and then turn around and show up in the evening to take classes. It's also not realistic to expect a student to drive an hour and a half between campuses to take classes. But it might be realistic now, especially, to expect a daytime student to flex to online asynchronous offerings from time to time. But that might not be their preference. So to kind of look at all of this, we study essentially the behaviors of the students in terms of their registration patterns within each program. So here's an example of a criminal justice program with a reasonable number of students, a reasonable head count of 83. But you can see how those students, that one population, gets fragmented into ultimately 5 different groups. So you end up with 30 online students, but you also end up with, out of the 16 Campus A students, 12 of them are daytime and 4 of them are evening. And of the 37 on Campus B, 21 and 16 respectively are daytime and evening. So you start to see how you get very, very small student populations if you're not paying attention to this, or if you kind of represent to your students so that they can take these classes in every way imaginable and still graduate. So this really leads us to the key question that we're wanting to ask in enrollment health, which is how many students are needed for a sustainable cohort? 4 is clearly too small because, you know, even if they were all in the same level of progress and through the pathway, which they wouldn't be, you would have in most cases a class that would get canceled if you were offering it strictly for that program of study as a degree requirement. So we need to ask the question, which is a hard question, how many students do we need for a sustainable cohort, and are we willing to communicate to our students, our advisors, our academic departments that we have a plan that really allows us to concentrate the way we offer courses and the way students should expect to take courses from us in a finite number of formats, a finite number of cohorts. So pathways can obviously play into this as well. So we analyze the pathways, and we're looking really at 2 key things. We're looking at course sharing, and we're looking at course choice. Sharing is when a course can be used in multiple places within a pathway, or more commonly across multiple different pathways to increase the overall health of that course. Course choice obviously decreases course health because let's say you have 2 courses that are only taken for criminal justice, and let's say you have 10 students that could take that program requirement at that point in their progress. But if you're offering 2 courses, you're going to end up with 2 very unhealthy criminal justice courses instead of 1 moderately healthy course where you might get 10 students to enroll. So what are some factors other than that, just in general, or as a summary, that we need to think about when we're managing enrollment in Pathway Health? Well, we have to look at, within each program of study, the average student credit hour load. How many credits do they take? And by extrapolation, how many terms will it take them to complete a program of study? Because essentially that population gets divided that way. We have to look at attrition. So we really get worried in enrollment health about the upper level program requirements or major requirements. But if half of the students stop out before they get to the upper level requirements, we need to factor that into the equation. And then clearly we need to look at pathway design, especially course sharing within the pathways. Again, to look at enrollment health or the health of the cohort, we want to analyze the head count. We want to analyze how that head count gets fragmented by completion tracks. We want to look at retention, and then ultimately the cohort size, which sizes which we can measure. Pathway health, we want to look at the health of the courses and the impact of sharing and choice on health. And then we can look at how different programs are managing enrollment in Pathway Health. Clearly, we would see a correlation between the 2. You can see the regression line here represents that at this institution, not surprisingly, there's a strong positive correlation between enrollment health and Pathway Health. But what we want to see is more and more of the programs above the regression line, because that shows that they're using their pathway design as an opportunity to improve program health. So in summary, why is it important? Well, it's important for student progress and it's important financially. We can't just continue to roll out low enrollment classes or cancel those classes and tell students they can't complete a degree or they're going to have to come back for another semester or two to graduate. And to measure it, we've actually even gone so far now as crosswalking our core student success metric of degree velocity with these enrollment health metrics. So in this particular case, we're looking at a two-year public institution and the relationship of when students are taking classes, time of day, and their degree velocity. And you'll notice here that the students on the far right in the red boxes that are unable to take courses across multiple different time of day formats are less likely to make progress because in most cases they're forced to essentially to bounce around in our schedules in order to make progress. So we want to prevent that. We want to have more intentional design so that we can have higher degree velocity and higher sustainability. So thank you for joining our discussion on enrollment health with Launchpad Learning. We look forward to talking to you more in the coming days.